This question is to ask, I'm trying to get the Minister to answer and to outline what, if any, action he has carried out on foot of a Dáil motion which was passed unopposed on the 28th of June in 2017, which instructed him to draw up a plan of action to help and alleviate and address the problems of people who are affected by the anti-malaria drug Lariam, which is given to Defence Forces personnel who are acting overseas on behalf of the country in parts of Africa in particular.
Thank you, Deputy Minister. 2 minutes.
As indicated to the Deputy in responses to the private member's motion on the 28th of June 2017 regarding the anti-malaria drug Lariam, the use of the anti-malarial drugs is a medical matter to be decided by medical professionals in the Defence Forces. These are matters for highly qualified medical officers, have regard to the specific circumstances of the mission and individual member of the Defence Forces. There are 3 anti-malarial drugs, namely Lariam, Malarone and doxycycline, which are used by the Defence Forces. The selection by a medical officer of the most appropriate drug for use in the complex one and dependent on a number of factors. Significant precautions are taken into account by medical officers in assessing the medical suitability of personnel to take any of the anti-malarial medications. It is the policy of the Defence Forces that personnel are individually screened for fitness for service overseas and medical suitability for all missions, and not just those in sub-Saharan Africa. As the Deputy will be aware, the second report of the Malaria Chemoprophylaxis Working Group was completed in 2017. The report was set out a number of recommendations relating to planning, training and education, information sharing and for the establishment of a medical advisory group. An implementation group has been established and is progressing these recommendations. The intent is that the medical advisory group will further inform internal and external medical advice to the Defence Forces on a range of medical matters, including malaria chemoprophylaxis. This will provide further support in the ongoing evolution of Defence Forces medical policy. These actions will ultimately serve to further enhance the existing medical care provided to all members of the Defence Forces, including those posted overseas. In addition to access to a wide range of primary care supports, a number of other supports are provided to members of the Defence Forces. For example, the Personnel Support Service makes confidential services, including critical incident, stress management and psychological support available to all Defence Forces personnel through its network of barrack personnel support services, officers and occupational social workers at formation unit and barrack level. In addition, my department has arranged the provision of a confidential counselling, referral, support service on a wide range of personnel, work-related issues for service personnel to the Defence Forces.
Deputy, 1 minute.
Very simple question. You can say yea or nay. Do you believe that you are acting undemocratically in the way that you and the military authorities are now acting, given that the Dáil passed the motion unopposed, which had the backing of all of the parties bar your own, which indicated that you had to carry out action which would help and alleviate the suffering of those who have had an adverse effect because Lariam was issued to them while overseas. Minister, you mentioned that medical experts. Well, if you go back to the 30th of September 1989, the World Health Organization warned that the new anti-malaria drug Mefloquine, which is Lariam, may cause severe mental disturbance and other psychiatric or neurological side effects. Airline pilots and others whose job involved fine coordination and spatial discrimination should not use Mefloquine to prevent malaria, the WHO said. That's the World Health Organization. There are 300 reports so far of neurological and psychiatric side effects associated with the drug out of several thousand patients. That's 1989. I've been raising the issue here since 2010, yet you have continued to allow the military authorities to use a drug which is no longer for sale in this state and has been withdrawn in many other military authorities throughout the world.
Thank you, Minister.
Deputy, I've reminded you on numerous occasions one of the reasons why Lariam is not manufactured here anymore is because Roche pulled out of Ireland for economic reasons. I've stated that on numerous occasions. But let me state, Deputy, that the medical policy in the Defence Forces is monitored constantly and reviewed when deemed appropriate. But I understand, Deputy, I know you had a private member's motion, but it would be totally incorrect as me, as Minister here, that I would go against the medical advice that I am being given by the professionals within the Defence Forces, The Director of the Medical Branch, DMB, advises the General Staff on matters of medical policy in the Defence Forces, and the Director of the Medical Branch's instructions further provide policy guidelines on medical and ethical issues in the Defence Forces and to medical officers. And additionally, medical officers of the Defence Forces operate in accordance with the Medical Council's Guide to Professionals' Conduct and Ethics for
Thank you,
registered
Minister.
medical
Deputy, your final
practitioners.
supplementary.
And we are working in line with the
Minister.
UN and the WHO.
Minister, thank you.
Minister, if a branch of the state is causing hurt to a citizen, then it is your duty as a minister and as a member of cabinet to step in and protect those citizens. That is exactly what is happening, has happened since I first started raising concerns about this, and probably before that in 2010. You said that your job is to take heed of medical advice. Well, the European Medicines Agency report 2014 says that there is enough evidence from the presented drug safety reports and the submitted literature report and the FDA, the US Food and Drugs Administration assessment report, supporting a causal relationship between Mefloquine, which is Lariam, and the occurrence of long-lasting and even persistent neuropsychiatric side effects. That's medical advice, and I also quoted WHO. So, Minister, who or when will you take action to prevent citizens, those within the Defence Forces, from being prescribed a poison which is causing long-term damage psychiatrically and neurologically to them? And at this stage, you've had enough warning, it's on your head, be it if people continue to die as they have done as a result of this drug.
Minister, to conclude.
First of all, Deputy, as I've stated in my original reply, that medical policy in the Defence Forces is monitored constantly and reviewed when appropriate. I have been given the advice by military authorities, namely the Director of Medical Corps, that this is the most appropriate drug when required, and that depends on the need of the person. It depends on the person itself, the mission that they are going on, and I hope that you also understand that I am restrained into what comments I can make here today as well, because of the number of litigation cases that are ongoing at the moment, two which have been settled and one which was withdrawn by the plaintiff. But it would be totally inappropriate of me not to accept the medical advice that I've been given by the Director of the Medical Corps.
Thank you, Minister. Moving on.